Hi, my name is Dr. John Wessling, and I'm going to talk to you about hypothyroidism. Thyroid dysfunction has reached epidemic levels and is a major cause of obesity, and our diet is largely to blame. Now, one of the most common thyroid problems is hypothyroidism, a condition when your thyroid is producing too few hormones. Now, your thyroid is a small butterfly-shaped gland located right here. It produces hormones that affect essentially every gland, tissue, and cell in your body. Your body will likely let you know if your thyroid is not working properly. Fatigue is the most common sign, followed by depression, muscle weakness, difficulty losing weight despite proper diet and exercise, sensitivity to cold, dry, rough skin, dry, tangled hair, hair loss, particularly from the outer third of your eyebrow into here, brittle nails, constipation, and forgetfulness. The most common way hypothyroidism is diagnosed is with a test called TSH, or thyroid stimulating hormone, that is elevated above the normal reference ranges. TSH is a hormone produced by your pituitary, which becomes elevated when your thyroid is malfunctioning because your body produces TSH in response to decreased hormone levels in order to jumpstart your thyroid. Now, it is important to realize that the TSH test by itself is not capable of detecting the vast majority of people who have thyroid dysfunction. Another issue that is rarely addressed is that adrenal impairment will frequently cause secondary hypothyroidism. In the majority of cases, the thyroid becomes impaired as a result of weak adrenal glands. The thyroid tries to compensate for this and eventually just gives up and stops working. Now, the treatment of choice for treating the symptoms of an underactive thyroid is synthetic thyroid. Unfortunately, in my experience, this will not help the majority of people who suffer from hypothyroidism. Once you stay on a thyroid hormone for a period of time, your thyroid will tend to become progressively less functional. And in time, it will probably stop producing any functional hormones whatsoever, which could condemn you to taking thyroid hormones for the rest of your life. Now, if you're listening to this video and some of the symptoms ring true for you, but you are not sure if you have a low thyroid and you are looking for an alternative approach, we can treat you using NutriSpec, which is a nutritional program in a nutritional company. We take a look at your blood work, thyroid panel, lipid panel, urine and saliva testing, along with filling out a metabolic assessment form. We then determine what vitamins, minerals, and nutritional supplements that's right for you. Now, I know what you may be thinking. You've had all the blood work done and it all came back normal. Well, there is a difference in what normal is in the lab ranges and what normal is in optimum functional ranges. Lab ranges, which are usually the broad ranges, is averaging the test results of people who are sick or who are already experiencing symptoms. Optimum functional ranges, which are narrower ranges, is averaging the test results of people who are healthy and normal. Now, there is a big difference here. It does not make sense to compare your blood test results to averages taken from people who are sick or who are experiencing symptoms. That's why being normal is not good enough. Normal blood test scores simply mean you are not yet as sick as the rest of the population used to determine the normal ranges. Now, the reason why this program is so successful is because it is based on testing, not guesswork, and by also doing follow-up retesting to determine your progress. So from this information, we can tell what foods and what supplements will bring you into nutritional balance, as well as what foods and what supplements will tend to do you harm. Now, from this data, we can formulate a nutritional and dietary plan to optimize your thyroid function. Now, if you are interested, you are welcome to contact me at westlingchiropractic@yahoo.com, or my office phone number is 316-262-3931. I'm looking forward to hearing from you.